Good day to Madam Fuzira and fellow student. We are from the group The Patriot. We have discussed and complete our research on the topic mental health awareness among population in Bandar Baru, Sungai Buloh, 47,000 Selangor Darul Ehsan. We did our survey, so about 50 respondents are chosen randomly to answer the questionnaire. Before I start, can I just ask from the floor, what do you guys understand from the mental health awareness? From the studies that our team have been done throughout the survey, the introduction of mental health awareness is the medical field of psychology or psychiatric. Mental disorder can be divided into three main categories. They are divided into psychosis, neurosis, and personality disorder. Patients suffering from a personality disorder or personality itself belongs to a mental illness. Okay, now from the objective from our research can be divided into two: general objective and specific objective. The first general objective is accessing the level of public knowledge about the mental illness.
I would like to explain the second objective, specific objective, measuring the extent of public knowledge about mental illness. Second, knowing awareness of the sign and symptom of the disease and responsibility to mental ill patients. Increasing awareness in terms of patient management, treatment, follow-ups, and community involvement in addressing the problem of mental illness.
Now, I want to explain about the literature review. Okay, first literature review. People need to get knowledge about the technique relations not only verbally but also through gesture, facial expression, and tone of voice. In addition to building a relationship with patient, the public must always be patient and give appropriate advice in accordance with the requirement of the patient. Sometimes, in creating a relationship between the community and the patient will show tough and irresponsible behavior. Society must accept this behavior as this might preserve with the tactics used by patient to test whether the public is reliable and responsible. It's said by Puvanes Virakandia, 1991. Next, literature review. Some of the mental illness can lead to communication problem between each other. Thus, around the public and parents must be encouraged during treatments on the runs. This can be done by involving parents in group meeting, listening to the patient and analyze a problem faced by patient and give the jobs to meet their times so they can along with others. It says by P. Keynes, 1991. Next, people thought that if I work in a mental hospital for too long, I will probably get a mental illness. But that assumption is not correct. I think the ability to listen, communicate, and meet people who have the symptom has a different personality because it changes your life. It teaches respect and understand yourself more, to interact with them, and more you know about the disease. It says by Grace Seal, 1990. The 7 components to care the mental illness. The first is to imagine yourself as a patient. This means that patient consider us as they are to earn the trust of patient. Second, it to give support to spend some time with the help of daily activity. The third of the instinct that always listen to, understand, and accept to patient as it is. The fourth of the two-way communication by showing respect and concern for patient. The fifth is to help patients build dreams and encourage patients to achieve their dreams. The sixth component is to establish a good relationship between patient and communities to facilitate the recovery process. And the seventh component is includes the feeling to love and care family, friend and community to enable these effective treatments. It's by Grains Hernandez, 1991.
Okay, next is research methodology. Research design. Descriptive method of decomposition method using questionnaire to collect data and information. Questionnaire were distributed to the respondents and the information obtained from the questionnaire. Use this format help researchers describe the data that is obtained by using graph and tables. The method is many advantages, among which is that it saves time and cost. Sampling. Respondents were used for this research involved 50 people randomly selected customer. Respondents involved should be given a brief description of the purpose of the study and the right technique to answer question to ensure that they meet the requirement of the question.
Assalamualaikum. Now, I would like to continue on our research discussion. My part is towards an application of rules to get the result. First, review and results. In this study, researchers have been using a set of questionnaires prepared by the researcher and distributed to the respondents. Questionnaires were used to obtain information from respondents in identifying customer understanding regarding mental illness. Pilot study needs to be done before distributing the questionnaire to the respondent to distribute the form to 10 people who are not related to the respondent. Pilot study aimed at assessing the level of understanding of the questions that have been prepared by the researcher. Through this method, researchers can improve the questions given sample if it needs the requirements of any doubt and not understood by respondents away. According to Abdul Ghaffar, MN, 1999, in making item assessment, taxonomy suggested by Bloom, 1956, is often used by researchers because it is more simple and rational. The researchers also apply this theory to test the cognitive different phases of low level and high level, especially to determine the level of knowledge in a research, so that our research using this theory to measure the level of knowledge of our respondents. Furthermore, for another section, we use open response question that require respondents to provide an opinion with respect to their knowledge of the research topic. The responses given in this section is in the form of data qualitative, but they were given a choice of where if they choose agree and strongly agree, we acceptable as agree with their choice, while if they choose disagree and strongly disagree, we will accept as disagree, so as well as the responses if their choice not sure.
Assalamualaikum, and I would like to continue another explanation for data collection methods. Methods that were collected using questionnaires. This form will be distributed to the respondents who were randomly selected, 50 people in Bandar Baru, Sungai Buloh, Selangor Darul Ehsan. This method was chosen because it simplifies the collection of information and facilitated researchers describe the data collected in a research paper. Statistical methods, data analysis. Questionnaire which was answered by the respondents, the researchers collected and analyzed using SPSS to get a clear picture of the stated objective. The information gathered through the questionnaire will be described in some form, include pie chart, graph, and percentage. Okay, analysis data. A total of 50 samples from residents of Bandar Baru, Sungai Buloh, Selangor Darul Ehsan were randomly selected to fill out the questionnaire. Okay, first, gender. The sample consisted of 37 respondents were female and 30 respondents were male. This situation may occur because women sometimes like to harbor feelings of oppression because they feel shy to talk. Okay, another is age. All respondents were people aged between below 20 to 60 years old and above. From the table, the age 21 to 30 years is 27 respondents, more than 41 to 50 years old, that only 3 respondents. Okay, for the race, a total of 50 respondents who found a different race is 34 respondents are Malays, while 5 respondents are Chinese, and Indian respondents were 4 respondents. Another race is 7 respondents. Okay, another is education. Most of respondents were 18 respondents uneducated, while 11 respondents complete finishing at primary school, followed by 11 respondents at secondary school and 5 people at STPN diploma level. They are also who graduated at degree level, a total of 5 respondents. Okay, another aspect is household income. For the household income, a total of 90 respondents earning 1,000 ringgit and below, followed by the total of 21 people earning 1,000 to 2,999, while earning 3,000 to 4,999 were 7 respondents, and the rest of 3 respondents income 5,000 ringgit to 6,999 ringgit. Okay, for the section B, knowledge about mental health. For the knowledge, according to the table, the study show the level of knowledge about mental health among the population is high. A total of 38 respondents and only 12 respondents who have a low level of knowledge about mental health. Okay, in addition, the knowledge about the causes of mental illness was found to be 27 respondents have a high knowledge and 23 respondents have a low knowledge. Okay, for knowledge concerning the treatment of mental illness was found to be 32 of respondents who have higher knowledge than the 60 respondents who have a low level knowledge. For the risk, whereas for the aspect in knowledge of the risk of mental illness was found to be 32 respondents have higher knowledge than 80 people respondents who have low knowledge. Okay, in addition, the aspect dealing with this disease was 47 respondents have higher knowledge than 3 people of respondents who have poor knowledge.
Section C. Public perception of mental health. Public perception of mental health among the residents of Bandar Baru, Sungai Buloh, Selangor Darul Ehsan. The perception of the people associated with the symptoms and signs of impairment in mental health that can arise as a result of pressure on the physical, social and environment varies greatly. It is because some residents say a total of 9 of residents said not agree, compared with 39 of residents agree with the perception. The perception of mental health nurturing feeling, thoughts and behavior that are positive in themselves, and thus a total of 44% of respondents agree with this statement compared to 1 disagree and a total of 5 of respondents unsure. The relationship between mental health and mental illness reflects a balance between the quality of life in a positive and negative. It is supported by a small population of 44 people of respondents who agree with the perception compared with 6 of the respondents who disagree. A total of 49 of respondents agree with their perception about the ability to adjust the state, interact with others and their surroundings, as well as a group can prevent the occurrence of mental illness that perform a good mental health. However, one of respondents are still not sure. As a conclusion, society should take the opportunity to improve a better life without experiencing any mental stress or mental illness. Overall, if lack of knowledge about mental health is a major factor that know the mental illness and followed by other factors such as heredity.